Hello, and thank you so much for joining today's webinar. Whether you're a single provider practice or a multi-location, a large organization, high levels of patient engagement and satisfaction are so key to your long-term success. So today, of course, we'll be discussing tips on how you can increase patient engagement and satisfaction in order to create a loyal patient base for long-term success. My name is Pauline Ith, and I'm the Marketing Account Manager here at GMR Web Team, and we help practices achieve greater levels of patient satisfaction, improve their online reputation, and increase their online footprints and presence so they can achieve long-term success and higher patient acquisition rates. So for today's webinar, we'll go over exactly why patient engagement and satisfaction is so critical in this day and age. We'll also talk about how it affects your practice and patient acquisition rates. And then of course, we'll be sharing 6 effective ways to increase patient engagement and satisfaction. And at the end, we'll wrap it up with the Q&A session. So if you have any questions during the presentation, please leave it in the Q&A section here on Zoom. And of course, if you miss any part of the webinar, don't worry about it. At the end, we'll send a full recording of the presentation once it's done. So let's get started. So we'll dive into exactly what patient engagement is, what is satisfaction, exactly why it's important for the modern day practice, right? So first off, what exactly is patient engagement? Well, nowadays, patients are more proactive in their healthcare decisions than ever before. And they care about the patient experience, right? So beginning from when they request an appointment to their outcomes. And that makes sense, right? There's so many options than ever before. The internet has definitely helped with that. Because imagine 20 years ago, 30 years ago, most people just went to a provider right in their neighborhood. They didn't really think too much about it. But now the internet has created so much choice, and it's truly empowered the patients to really care about what they're getting out of their appointment and visit. In addition to that, the internet has also given them a resource to learn about all possible diagnoses and treatment options. Whether that's beneficial to them or not, that's debatable, but the information is there for them. So patient engagement is just all about, nurturing a strong relationship between the patient and the healthcare provider, because patients, like we already said, want to understand every aspect of their care and what their providers suggest for treatment. And the entire goal essentially is to ensure that patients work with their providers and healthcare teams to improve the overall, treatment outcome and results. And patient engagement often goes hand in hand, with patient satisfaction. And like I mentioned before, patients expect a lot more from their appointments and have, a lot of different options. If they're not happy with one provider, they'll go somewhere else. So not only do you have to engage patients, but you also have to consider patient satisfaction when it comes to running your practice. And many people think that patient satisfaction is connected more to exactly what kind of treatment or service the patients receive and the interactions with actual providers, but it's becoming, like I already mentioned, it's so much more than that. And I'll keep emphasizing that throughout the presentation, but patients truly really want to be delighted with the overall patient experience. And it's great for healthcare organizations so they can, improve operations and the care, right? Because patients, factor in the pre-appointment experience. Was it easy to make an appointment? Did they speak to someone who's empathetic and efficient in getting them, their desired appointment? It goes to interactions with the front desk staff. How is a new patient intake process? Is it easy to reach the staff about billing? What if they have insurance questions? And then it also factors in how well they like the office, right? Is it clean and well lit? Is the equipment up to date? And patients, of course, always care about, the care they receive from their provider. Did the provider have great bedside manner? Did they answer all the questions, or did the patient feel rushed? Were they just pushed in and out? And were their treatment options explained? And did the provider, answer all their questions in detail? So all of this matters, right? So the engagement and satisfaction, because it does, at the end of the day, affect your bottom line, right? So, benefits of high engagement and satisfaction include, just overall better outcomes for patients, right? So engaged patients and satisfied patients are more likely to schedule their routine appointments, reach out if they need care, They'll also follow the treatment plans, right? If they have that close relationship and that strong relationship with their provider, they're more likely to follow through and then actively monitor everything, right? The other thing is, it just builds, like I already mentioned, a stronger relationship. That means a more loyal patient base who are less likely to leave your practice. In addition to that, that kind of builds upon, referring you out. So loyal patient bases are more likely to promote you and your practice. So, and that means more new patients for extremely low cost, right? Practically free. Kind of creates a little bit of a cycle. So you have satisfied patients, they refer you to others, those people come in, they're satisfied too, and then continue the referral process. And that also, right, increases your revenue. And this also includes not just new patient acquisition rates, but your current patients are returning for their visits, making all of their payments if they have to. It's clear because unhappy patients will, be trying to avoid that bill, right, that they got to pay. And also, in addition to that, satisfied patients, they'll be more likely to leave you an online review too if you have a system and a process set up. And in addition to that, they will, make sure they spread good word of mouth about your practice, and about your reputation. So it creates a stronger brand. You're known for providing, great care, really good satisfaction levels and engagement, right? Because you always want to think, what happens if you have really unhappy patients, right? Poorly engaged, unsatisfied patients will likely leave your practice, right? They'll leave negative reviews. They'll spread negative word of mouth. In addition to that, you don't think about it, but they also affect your staff, right? Unhappy, unsatisfied patients will affect employee morale, right? If you keep losing patients. Something I also want to emphasize too is that if you're spending money right now to acquire more patients and implement, a comprehensive marketing plan, you want to make sure every new patient that you acquire is satisfied and engaged, just like your existing patient base, right? So people always focus, when I talk to practice, they're always like, I want new patients, I want this and this, but then they forget about keeping the new patients happy and then keeping their current patient base happy, right? Because if you're, increasing the volume of patients that are coming in, you just want to make sure everyone's satisfied and you're keeping that high level of care. So that's why it's critical to make sure you have some kind of process in place for patient engagement and satisfaction. So let's talk about the 6 ways you can do that, right? Increase patient engagement and satisfaction. So before you make any changes to improve engagement, you just need to understand the current state of patient satisfaction. So we suggest surveying patients after their visit. We recommend doing this continuously, but especially if you're brand new to doing this, doing it very consistently, for the first 1 to 2 weeks before you make any changes to see what kind of comments you get. And we always recommend surveying patients the same day they are being seen. This produces the most honest feedback, and shows patients that really care about, what happened during their visit. Because if you survey them a month, a week after, they're going to ignore it or they're going to forget, what happened during their appointment. So you want to catch it really early. And like I said, it really does show your practice. It shows that you care. Shows your patient that your practice cares. And of course, it also helps you understand where exactly you can improve, because you want to make sure you catch any current issues before they really become recurring patterns or they affect the new patients that are coming in too, right? You don't want any new patients to experience these issues, then they will leave, right? They're kind of wondering, okay, why did I get recommended to this place in the first place? So let's talk about how you can survey and talk about GMR's particular process, because we do implement a survey process for all of our clients. So with our process, we ask patients just one simple question: how likely are you to recommend the provider or practice to a friend or family member? And from there, patients can rate on a scale of 0 through 10 and leave a comment, below in the comment box. And from there, we notify our clients of any negative feedback immediately, and it allows their team to reach out to the patients quickly. And oftentimes we find that patients often will just experience a misunderstanding or miscommunication. So they really appreciate it when you do reach out and say, hey, I'm so sorry your visit didn't go well. What can we do to fix it? And it just helps you to stand out to other practices and organizations, right? You actually care about what the patients think. You're not just pushing them out and then, taking the next person in. So for the survey process, we recommend checking if your EMR system has some kind of survey feature if you're not working with an agency like us. But there are definitely other HIPAA compliant options out there. But we just recommend something that integrates with your EMR just because it takes a lot less work from your staff and you're ensuring that every patient gets surveyed. So definitely recommend that. And second tip is to actually review the feedback, right? So you don't want to have these surveys go out and no one's taking a look at what's going on. Because like I already mentioned, but patients really reveal a lot. For example, they just talk about the overall visit, accuracy of the diagnosis, how well you diagnosed, treated, and then, explain what treatment options there are. In addition to that, they will talk about wait times for sure, and they might not mention that to you in person, but we find that a lot of patients are pretty vocal when you give them a space to do so, right? Another thing is staff interactions. If they had a pleasant interaction with your staff, they'll let you know. It's really critical to remember too that poor interactions can really drive away the most, loyal patients. So just want to make sure your staff is on point, especially if you have a new staff member, a new provider, a new front desk person. You want to keep tabs on that. In addition to that, they'll definitely also mention if you have any issues with billing, obtaining prescriptions, getting the referrals they need. And just like I said, from our client observation, a lot of complaints really have to do with staff or not being able to reach the practice, not having access to their patient portal. It doesn't typically have to do too much with the provider and what kind of level of care they receive. So it's something that every practice can have essentially a way to fix, right, and improve. So like I mentioned, here are some tips. You want to review all feedback, right? So positive and negative feedback both matters, and identify any trends. So right now with our clients, we do notify them of all the negative feedback, but we do like to write them hey, this is what you're doing well and what you should keep doing. So you can kind of identify the most common complaints. What do patients love most? Is it a particular staff member? Is one provider just really providing excellent care? You'll find out, right? And I recommend categorizing each survey if you can, to have one be about, category be about provider experience, one about front desk, one about wait times, billing, and then another about lab results, just because then you can find out if it's a recurring pattern with each and you have some, data to go back to. And of course, the last thing when it comes to reviewing feedback is to make sure you actually have an action plan. Again, you can do these surveys and get all the information, but if you're not taking action, then the surveys aren't as effective, right? You're not actually engaging the patients and working on improving satisfaction. So, we recommend working with your staff, having someone be in charge of reviewing the feedback. And once you're identifying patterns, talk to your staff and see, okay, what's going on? Is it with the front desk? Is it an issue with answering phones? So then you can maybe make a script of this is the protocol we should follow, or just have someone whose strength is answering phone calls be at the front desk, right? Because we don't want to lose any new patients or existing patients that are trying to make appointments. So that's tip number 2. Tip number 3 is to utilize appointment and confirmation reminders. So this is one of the easiest ways to engage patients and increase satisfaction levels. You just got to remind them of their upcoming appointments. So remember, everyone's lives get super busy. So appointments that get scheduled months in advance, or even the next week, they can get lost. So appointment confirmation reminders can definitely help reduce no-show rates, and allows patients just an easy way to reschedule appointments if something comes up, so they can make the adjustments as needed, and the staff can reschedule and put people in their place, right, for those open appointment blocks. So I found this study, and it shows that confirmation reminders can actually reduce no-show rates to about 13%, right, if you have a staff doing the reminders. So it's great. It's a lot of patients coming in for their needed care. You're not losing any money, with having patients miss their appointment blocks, right? So having the staff call is definitely a great personalized method, but it might not be doable for every practice, especially ones that just get a high volume. So we definitely recommend having some kind of automated system, whether that's email or text. At GMR, we're able to do that and connect with your EMR and automatically send it out. It's just really efficient and a great way to make sure, if like I said, if any patient needs to reschedule, they can do so. So I always get asked, like, how many appointment confirmation reminders should you send out? Um, Overall, you'll need to find out what works best for your particular patient base. And, if you have patients that skew a little older, they might not want as many reminders. Maybe if they skew a little bit younger, they do, but it really depends. And you want to make sure you're adjusting to what makes patients happiest, right? Just off the bat, recommend having something 1 week before the appointment, 3 days before the appointment, and then just 1 day before. Some of my clients, they have cancellation fees, right? So they want you to notify them within 48 hours if you cancel, otherwise you get charged. So if that's the case, I recommend at least having one 48 hours beforehand, just so patients aren't caught off guard, by a cancellation fee. And of course, if patients confirm, you just want to make sure your system is not sending out any more texts, right? That's gonna definitely bug people, and maybe show that, hey, you're not listening, like I already confirmed the appointment. So like I said, this is a great way to implement it. There's a lot of different vendors out there that can do it. GMR can't, just through our platform, but you can check with your EMR. Your EMR should be pretty powerful in having some kind of confirmation reminders being sent out. Yeah. So tip number 4, another way to engage patients, just to send out holiday and birthday e-cards, because patients do want a customized experience. You want to build that relationship. So this is an effective and simple method of just, reaching out to patients while also keeping your practice top of mind. So you also want to personalize the greetings. We send one for our clients' patients, birthday cards every month via email. And we keep the message pretty simple and heartfelt, and just let patients know we're thinking of them, and, hope they have a great birthday. So right, you always want to just let them know you're thinking of them. Don't sell or pitch anything. This just should be straight, from your own concern and just like your wish for wanting them to have a good holiday or a birthday. So I definitely encourage everyone to send at least, a holiday or New Year's card at least. I definitely encourage to make it customized, including photos of your staff, or just left the practice. I know some clinics send a physical card. You can definitely do that, but it's more cost effective and efficient to send out an automated email. And it goes out right away, the patient receives it, and it's, like I said, more cost effective. So this is another way to keep your practice top of mind and just, let patients know you're thinking of them. Tip number 5 that we have is to send out newsletters. So they're definitely a valuable tool to communicate and connect with patients, and it can show, you're top of the field. You're always providing great advice. A lot of practices that join GMR actually don't even, have a newsletter going out. It's something that's definitely, I think, not thought of for a lot of practices, but you definitely want to send out something at least monthly. It helps keep your practice and providers top of mind. It also gives a way for patients to just share more information about your practice with friends and family, right? Like, hey, my doctor gave me just some tips, check out this newsletter. And it also is a way for you to share any offers and any new services, right? So if you are a dentist and you're like, okay, well, now we're doing implants, it's a great way to just include it every month and just give a reminder, hey, this is what we do. So let me share specific things that I like to include in my client newsletters. It's something you can easily do yourself. So this is just an example of what I do for my dentist in Arizona. We include a photo of her, the office, just kind of make it a little personal. That's her personal touch. She wanted to add just a photo of the office. And then you can also add what's going on. So recently you had a holiday party, add that into the newsletter. Patients really do like to engage and see what's going on, and that, your practice is really warm and welcoming. We write blogs for our clients, so we also include that. So we recently had one about treating cold sores, so we added that here in this newsletter. And of course, any reminders for routine exams and screenings we like to include. So in this case, we had, hey, start 2022 off right with the dental exam. So we included that in here, and just a good reminder of having patients easily request appointments, from their email. That's a great way. And then in general, I like to keep a lot of the newsletter pretty educational, sharing helpful articles, tips, maybe what's going on. For example, if in the beginning of COVID, we shared a lot of news about, hey, you shouldn't skip your appointments if you can, even with COVID going on. All practices have really safe protocols to come in. And And it's just, like I said, a great way to engage patients and just keep them up to date with everything. So next tip number 6, I recommend reaching out about preventive and routine visits. Again, patients, like I mentioned in the beginning, they want to have a lot of control and be involved in their care. So with a lot of technology available, you should be able to look at a lot of different options to reach out and engage patients about, upcoming or preventive visits. And, it just helps them say, hey, it's time for your routine physical, or it's time for your next dental exam. And it just helps you, helps you and them to stay on top of their health. I know some practices call or send like physical mail, but you can definitely automate the process through text or email. Phone calls are definitely great, but like I said, with high volume, you got to, consider the staff's bandwidth and what they can do in an 8-hour day. So I recommend doing something automated. You can definitely work with your marketing team to do something, to send out to patients. But a lot of patient portals might have, reminders so you just want to see what options are out there. Again, reaching out about these visits just shows that you really do care about their health. You want to make sure, nothing progresses, into really high complex cases, and you're just encouraging patients to be active in their care, right? Giving them a little nudge. Okay, so we're at the end. So these are just some of the key takeaways I want to go over, because I know we covered a lot of things. So, we talked about engagement and satisfaction and how that will impact your long-term success. So higher engagement and satisfaction levels result in a more loyal patient base to help you succeed in the long run. And then one of the tips we discussed to do this is to survey patients after their visit, right? To help you understand satisfaction levels and what went right and what went wrong. And we also recommend that you review all feedback, and just work with your staff to create an action plan to correct any issues. And then we also recommend using appointment confirmation reminders to help reduce no-shows, engage with your patients and making sure they show up to their appointments, to make sure they get the care they need. And then lastly, we talked about just different avenues, with newsletters, birthday, e-cards and things like that, just to let patients know you're thinking of them, to give them the latest news, share tips, and then just to recall them for critical routine exams. So yeah, so let's do the Q&A. Let me see here if we have any questions in here. Okay, so I have one here. It's just to ask, can we use social media for patient engagement? Yeah, definitely. So you can definitely have, social media posts that kind of relates to exactly what we talked about in the newsletter, right? You don't have to reinvent the wheel. You can say, hey, we have this new service, or hey, it's time for your routine exam. And then I definitely encourage you to have some kind of QR code or poster in the office to tell patients to follow you, and then work with the front desk staff to kind of integrate that in maybe their checkout process, or when they become a new patient, like, hey, follow us on Instagram or like us on Facebook for just more updates. So, you can keep patients in the loop with everything. So I definitely recommend that. Let me see here. Another question is, what if we don't have an EMR? How can we survey? Yeah, so that's good. So I noticed some smaller practices might not have EMRs. So it does make things a little bit more complex, but not too much. You just want to make sure you train your staff and just emphasize the importance to them of, maybe manually sending out surveys. So with GMR, we do have a process for practices with no EMR, so they can just upload patients they saw that day and then the survey gets sent out. I'm pretty sure other vendors should have an option for manual, uploads and surveying. So definitely check with your vendor, but that's still an option. You can still send out surveys. It just requires a lot more discipline from the staff. So just make sure you do that. Let's see here. And then, let's see. Last question here. Can we have more than one question on our survey? Okay, yeah, so I get this question a lot too. You can definitely have more than one question. With GMR's method of having that one question of like how likely are you to recommend, it just allows patients to easily just answer quickly one question, and it increases the what we call the survey conversion rate, so the percentage of people that answer the survey. Some practices we work with do want to have multi-question surveys. I just wouldn't make it anything too long, like more than 5 questions, just because then that patients get really tired to like answer everything. So I recommend having 5 questions. Maybe some of them have a comment box, but some of them are just like a numeric scale or a Likert scale where you ask like most likely or least likely, stuff like that, because that just makes it easier for them to answer during the survey process. But I definitely, it's not a bad thing. You just want to see what works for your patient base, because every practice patients, are pretty, unique in terms of their behavior. So you just want to see what works best. I always say there's recommendations, but if you find out that doesn't work, you should always be adjusting, right? If you're doing the 1 question survey and it's not, you're not seeing good conversion rates, and then it's something you got to discuss with your team, see, okay, should we let patients know they're going to get a survey, give them a heads up, things like that. So you always make sure you adjust, right? And that's why you track everything to see what's going on. Like I said, to make adjustments, that's so critical. Perfect. I think that's all the questions we can take today. I don't want to take too much of everyone's time. I know everyone's got a busy schedule. But yeah, we're GMR Web Team. So I want to thank you guys so much for for joining today's webinar. But if you ever need help expanding your online presence, getting more patients, looking how to monitor patient satisfaction, definitely give us a call, visit our website. You can schedule a free consultation with our account managers. And we can also do free SEO and website assessments too. So you just got to connect with us, and then we'll help you out. But yeah, thank you so much for joining. Again, if you miss any part of the webinar, we'll be sending the recording right after this. And it'll also be up on our website too, if you ever want to come back and refer to it. So again, thank you so much for your time. And I hope you guys have a great rest of your day.